good to be with all of you again this week, and we're reaching the midpoint of the semester. And for this week's presentation, as we enter the winter months, I wish to focus on seasonal influenza, what we might expect this flu season, and how the presence of both the flu and COVID-19 could pose challenges. We strongly encourage everyone to get their annual flu vaccine in addition to their COVID-19 vaccine. Vaccination against the flu means first and foremost, people will be protected from the disease. But in the context of COVID-19, there are additional advantages to receiving a flu shot. It means that someone is less likely to experience flu-like symptoms, which may be confused with COVID-19. And it is a way to reduce the number of people in our hospitals and protect those most vulnerable in our communities, those most impacted by the harmful effects of both the flu and COVID-19. Many of the symptoms of COVID-19 and the seasonal flu are similar. This is particularly true if you are vaccinated against COVID. With a COVID-19 vaccination, COVID symptoms are generally milder and may be similar to a mild case of the flu. While symptoms could be easily attributed to the flu and resolved without treatment, it is important to ensure they are not caused by COVID-19 in order to prevent further spread. We're encouraging everyone to track any flu-like symptoms through our GU360 Daily Symptoms Attestation app, and if they have symptoms, to get tested for COVID-19. There are some characteristics of flu season that are familiar to all of us. While the flu circulates year-round, we see an increase in the number of cases of flu in the winter months. Cases typically peak between December and February each year. During this time, we spend more time indoors in air that is cold and dry. These are the conditions in which the flu virus can more easily survive and spread. We generally see 20 to 40 million cases of the flu in the United States each year. In the 2019-20 season, there were estimated to be around 38 million cases of the flu. Each year, 500,000 or more require hospitalization. Last year, we faced a dramatically different year with regards to the flu. Public health measures such as physical distancing, mask wearing, virtual learning, and teleworking, and reduced travel during the holiday season put in place to respond to COVID-19 also reduced transmission of the flu. We also saw an increase in the number of people who received the flu vaccine. 193 million people received a flu shot by January 2021, 20 million more people than the previous year. While the flu vaccine is encouraged each year, many places made additional efforts to vaccinate communities with the flu shot as part of an overall response to COVID-19. More than 800,000 flu tests were conducted between September 2020 and May 2021. Fewer than 2,000 of these tests were positive for the flu, a positivity rate of 0.2%, unusually low flu activity, according to the CDC. Recall that during this same period, September 2020 to March 2021, we saw significant numbers of people infected with COVID-19. At the peak in early January, we reached 300,000 new cases of COVID-19 per day. We have never experienced an annual seasonal flu that compares in any way to COVID-19. So what will the flu look like this winter, the seasonal flu? Well, it's hard to predict, though many experts are anticipating this flu season could be particularly severe. What have we seen this year at Georgetown? In mid-September, we began to see an uptick in the number of seasonal flu cases among undergraduates. This was a few weeks earlier than we usually see the flu on our campuses. Since September, we've had more than 85 test-confirmed cases of the flu. All members of our community are asked to log any symptoms in the GU360 Daily Attestation app. With this daily symptom attestation, we have been able to differentiate those with seasonal flu-like symptoms and those with COVID-19 and refer them to appropriate medical care. When it became apparent last month that we were dealing with an unusual cluster of cases of the flu, we quickly implemented a flu vaccine clinic for our undergraduates. More than 1,000 students got their flu vaccine at 2 vaccine clinics, which were run in collaboration with student volunteers. More than 15 seniors in our nursing program helped to administer flu shots. Earlier this month, we launched our regular annual flu vaccination clinics for all members of our community, and these clinics run through mid-November. We strongly encourage everyone to schedule an appointment for their flu shot as soon as possible. A few weeks ago, we also faced another public health challenge, an outbreak of a gastrointestinal illness on our main campus, determined to be caused by norovirus. We had roughly 140 cases over a 2-week period. Unlike the flu and COVID-19, which are respiratory viruses, norovirus primarily impacts the gastrointestinal system. Symptoms are usually experienced for about 12 hours. It is highly contagious and can be transmitted from person to person and through surfaces contaminated by viral particles. It requires specialized cleaning practices to disinfect surfaces. With our public health infrastructure in place, we were able to quickly detect something unusual through student reports of symptoms and rapidly respond, providing hydration and clinical support to students, initiating deep cleaning of public spaces and residence halls, engaging with the DC Department of Health to launch an investigation of the source and the cause. While we were able to identify the cause, norovirus, we were unable to determine the source. Our layered public health program has enabled us to address these additional challenges, and at the same time, COVID-19 cases on our campuses have remained low. Our positivity rate has been at or below 1% since the summer, even as we implemented arrival testing. For our arrival testing program, every member of our community returning to our campuses received a COVID-19 test. Again, we encourage everyone to get vaccinated for seasonal flu, and we're grateful to all of you for your commitment and response to our public health program. It will be important for all of us to continue to closely track and report any symptoms, especially as we enter seasonal flu and allergy season. Care navigators are here to help you determine any steps you might need to take to respond to any symptoms. Thank you all for joining me today and for your engagement, your participation in these important public health measures which contribute to the health and safety of our community. I look forward to seeing you all again next week. Take care of yourselves and take care of everyone around you. For every Hoya, everywhere.